very pleased to introduce to you our next speaker, who is the president of the Performing Arts Medical Association from the Musicians Clinics of Canada. Please welcome Dr. John Chong.
Okay, thanks. Thank you very much. Greetings from the Great White North. I really miss the snow, haha. So I come from Toronto, and we play a lot of hockey, and we do have a lot of concussions there. But I'm going to share with you some of the history of the musicians' clinics and also the Performing Arts Medicine Association. It's been around for just over 30 years. It was started by Dr. Alice Branfenbrenner. It's dedicated to the well-being of performing artists, the health of. And we have a wide multidisciplinary group of professionals in our organization, and we like to grow it. Our website is artsmed.org, and our journal is Medical Problems of Performing Artists. So my history began when I was 3 years old. For some reason, I grew up in a laundry, and my father had some beautiful nannies to look after me and got a piano. And so I started playing the piano, but I got pretty hooked on it. So when I was 12, my dad said, he's getting pretty good. I think I should buy him a Steinway. So you get a kid with a Steinway. It's sort of like giving a testosterone adolescent a Formula One car. And guess what happened? It didn't take long before I got hurt. Oh yeah, and a big pile of Beethoven sonatas and Chopin etudes, etc. So that's how I got into it. But I didn't really think about that when I went through engineering and medical school until the Canadian musicians came to me in 1986 when I was a junior professor in occupational health. And at that time, they had passed the Canada Health Act, which guarantees universality, accessibility, portability of health care in Canada. And since '86, we've been seeing musicians. So back then, I really wasn't sure what I was going to see. I was used to seeing all kinds of injured workers. So I made up this acronym here. If you're good with crossword puzzles, you'll see what it says. So muscle fatigue, anxiety, depression, nerve entrapment, and various stress syndromes, which is madness. But more seriously, science has come on. We do have a really big epidemiologic study of 400 professional orchestra players from Australia. And you'll see a long list of risk factors. And what is striking is how common these injuries are, severe enough to impair their playing, and 50%, 50-50 chance of playing hurt, which is a bit astounding when you think about occupational medicine. Excessive muscle tension, long practice, insufficient rest, poor posture, muscle fatigue, sudden increase in playing, repertoire selection, scheduling, stress, lack of fitness, insufficient warm-ups. So that sounds pretty familiar to you guys in sports medicine, but in the world of performing arts, it's not as well accepted. A little bit of biological basics. Those of you who play a musical instrument, raise your hand. Woohoo! That's your brain on the left. That's the motor auditory pathway. And if you want to go to law school or accounting, that's your brain on the right, a non-musician. So there are structural differences, but what's the whole meaning of music? It's all about dopamine. Why do we play sports? It's about dopamine. We want to win. Well, in music, this is a study looking at dopamine uptake using PET and fMRI, pretty innovative. And you can see those hot dots in the caudate and the nucleus accumbens ventral tegmental area, the pleasure center. So it is about pleasure. It's not about money. It's about really having a lot of fun. And that's in the audience. So our goals are really set. We don't have a scoreboard, but in a sense, if we had MRI and PET scans in the audience, we do have that. So basic laws of neuroplasticity, what fires together gets wired together. We all know about the homunculus, and that's what we look like, the somatosensory little man, or little monkey, I call him. So this little guy's going around learning how to play piano and having lots of fun, but making a living is a little bit different. So it's a long road to become a pro musician, and we can encounter a lot of resistance, adversity in childhood education, And in the workplace, we have a lot of cortisol production from the adrenal glands, which, as you all know, live on top of your kidneys. And we could develop a chronic stress response. We now know much more about the mind-body connection, thanks to the polyvagal theory, the vagus nerve. What happens to the vagus stays in the vagus. Okay, so if everything's great, you don't have to worry about it, everything's great. But when we develop a fight or flight or an immobilization or a depletion syndrome, a lot of things can break down, which are summarized. Now, why is this so common is the question. So a lot of amazing research has gone on in the last while. So if you remember that the stress system has no off switch, if you think about it logically, why would we want to turn it off? We want to protect ourselves. So it's a feed-forward system, so you can memorize that what goes up must come down. Spinning wheel got to go around is the normal response. When you have too much stress and chronic stress, you have an up, up, and away song. Okay, it just goes wild. And it's been recently quantified that 1 year of stress equals 6 years of biological aging. Just like, oh, that won the Nobel Prize in 2009. So it's just a matter of time. If you let this runaway train eat your telomeres up, you end up in the basement pretty quickly. Now, how does this relate to muscles? Well, that story of adversity that creates a sympathetic tension in your muscles and then activates spindle cells in your muscles, giving pain. It's memorized in the brain, and you have this feed-forward circuit. Also, the psychological environment is very important, because if you think about playing a violin or playing piano, it's not like the hammer or hitting your head playing football. But this was an interesting bit of work, that if you do a social stress test and put the students directly into an fMRI scanner, you get the brain lit up. How interesting. So I've called this targeted humiliating criticism, or THC for short, well, which is the bad stuff. In Canada and Colorado and places we have good stuff. So this is bad THC. So there's been no shortage of business from THC or whatever exposure mystically that's in this workplace. We have interventions, A, B, C, D, E, F, G. We're going to work with a volunteer here using the first intervention, surface EMG motion video, and biofeedback. We have other methodologies which we can go into, but time is short. So I do have this portable artist psychophysiology and ergonomics lab, which is commonly known as the APE lab, which goes around with me. And we'll bring in our subject, all wired up. I think you might remember who he is. And we'll fire up the computer. And we'll start the first bit of studies. So hopefully this will work. So we're going to do first the motion analysis. So we have 8 motion sensors placed on Dr. Lightfoot, 4 axially and 2 on each arm. So we're connecting it, and hopefully we get contact. Houston, come in, come in. Whoa. Woo! It's past Halloween, eh? Okay, so on the left, you'll see the top 3 lines are cervical spine motion, and the bottom 3 are lumbar spine. So if Tim says yes, we'll see some movement, and no, some rotation. Should get some data going. So I want you to turn towards the screen so you can see what's happening. I'll try to get out of the way of the camera. So you have a video left lateral. You have you. So let's play a little quick tune, 10 seconds worth. Okay, just a sec here. We have to. Okay, so we should be good. We'll rotate this guy around. Come back here, you. There we go. Beautiful. Okay, so let's record. Away we go. Play away. Beautiful. So it's pretty obvious what the biomechanical issues are there. So I'll play it very quickly. Time's precious here. So with the biofeedback, you can see the strain on the cervical spine. You spend most of your time looking at your hands, practicing. So after X number of hours and notes and years go by, we see a lot of cervical spine problems and nerve problems down the arm. So there's a quick example. We'll go back and then we'll see if the muscles work here. Activating hardware. Good. Perfect. So again, having a look. So the top line on the left side is the left upper trapezius. The second line down is your right upper trapezius. The third line down is the left forearm. And the fourth line down is the right forearm. Now it's quite hard to see, unfortunately. On the bottom, the fifth line is the heart rate, which is now sitting at 100 beats per minute, which is not bad for you, Tim, eh? Cool. He's cool after all this. Yeah, and we don't want to measure mine right now. Okay, so you may want to think about all this cervical flexion. No, you want to look at yourself and do your own self-diagnosis with the biofeedback and make a correction. Because if you keep firing your traps, you're going to get fatigued much quicker than otherwise. Very good. So what do you think? That better? Okay, so let's play it again. And try to keep the trap tension way down. Away you go. Okay, good. Thank you. So I want you to let's just, yeah, we're playing it back now. You can sort of hear the sound. So you can see a lot of activity in the right trap. Less so on the left, and a lot of activity on both sides. So what correction do you think you could pull off, since we only have a 1.5 minute?
My wife always says that when I play, I look like I'm hunching my shoulders. So I got to relax my shoulders.
Okay, so let's do it. So
Okay.
by watching. So I guess the pun there is you should obey your wife.
That's right.
She's right. We don't need all this stuff. Okay, so let's do a little body mapping. Relax all your feet, knees, hips. Okay, hear the water coming in from the ocean. Breathe. Relax your shoulders. Okay, there, that's better. Okay, so forcing yourself to correct often doesn't work. So we have to create an image where you're relaxed. Now the goal is to create dopamine in the brains of your audience, not to be worried about what they're thinking. They're not thinking about this stuff. Okay, so create little blobs of dopamine in their caudate and their pleasure centers. Okay, see if you can get that. Keep breathing. Ready, go. Go. Yeah. Just excellent. So we'll call that one, just add a 2 on it. Save and view. And you'll see a difference just with that bit of advice. actually you'll see that the heart rate changes because you're breathing. Okay? So that's the heart rate variability, but it has a direct effect on muscle tension and activation. So you're seeing releases there that weren't there before, okay, which gives the muscles a bit of a break, less glycogen, more oxygen, blah, blah, blah. So you guys know all that stuff. So just a little quick tip like that can go a long way. So just a few minutes, 5-10 minutes intervention, and we might save you some orthopedic neck issues and later on. Okay, so that was a little demo of some of the interventions we can create very quickly with the new technology. Thanks very much. Okay.
So we have a couple of questions. One of the questions we got from in the auditorium is how applicable is this to the everyday musician?
Well, good point. The everyday musician has access to this if you're a student at the Glenn Gould School in Toronto, which is the elite performance training academy in Canada. If you're a patient of mine, we use some of this technology all the time in treatment for all these injuries. Hopefully we'll begin to work together and collaborate and share with the amazing technology we have and cross-pollinate with sports and performing arts.
Well, and that's what I was going to ask. The next question is, so is this the same kind of thing is applicable to other, not just performing arts, but to other kinds of sports?
Absolutely. This is fairly universally used in sports medicine if you're familiar with the technology, as well as in occupational medicine and work analysis. So it's available to be adapted for our interesting uses for vocal and dance and, of course, musical instruments.
Great. Join me in thanking Dr. Chong today.
Thanks very much.